I'll move to approve the minutes.
So the next piece is our usual organizational piece. I want to start out by apologizing for the kerfuffle we had last week. Apparently there was last month, there was an inherent issue in the glitch in the programming that posted our meeting, even though there were two places to post. The automated posting got it wrong and posted it at 6:30, which is the public posting, and the rules to allow for public participation so that we don't have a meeting posted at 6:30, start at 5:30, and are walking out the door when anybody from the public might come in. We were obligated to make it a 6:30 meeting, and I know that made for some issues with some of the folks, and apparently, since we're mostly here now, and the other folks who couldn't come had nothing to do with that, that glitch has been repaired.
Oh, I'm sorry. Yeah.
That glitch has been repaired. Also, we have another new member, Dr. Seth Rubin, and I've asked Dr. Rubin to give us a couple of minutes of background. So please.
Hello, I'm Seth Rubin. I'm a family medicine doctor. I practice in Bryn Mawr, on the campus of Bryn Mawr Hospital. I work for Mainline Healthcare. I've been working with Mainline Healthcare and practicing medicine in this area since 2010. But I'm originally from southeastern Pennsylvania, so I'm a native to the area. And it's my pleasure and my honor to be serving on the Radnor Board of Health.
Where'd you go to high school?
Ben Salem High School.
Oh, great. So that's sort of southeast Pennsylvania. So we've done this a lot because we've been bringing a lot of people on board, but I think if folks can introduce themselves for Dr. Rubin in 25 words or less, maybe we can go around and you can get an idea of who we are seated on the board already.
My name's Lisa Hammaker. I'm an endocrinologist with Einstein's network, and I work in Collegeville and King of Prussia, and I'm a resident of Radnor here for 14 years. Nice to meet you, too.
Hi, how are you? I'm Julie Kohler. I'm a clinical psychologist. I have a private practice in Villanova. I live in Radnor. I've been here for a couple of years now. I have 2 kids in the district. Nice to meet you.
Hi, my name is Kathy Durr, and I'm currently the vice chair on the Board of Health. I've been on the Board of Health now 6 or 7 years now. I do live in Radnor. I work in the laboratory profession, and I currently work for Simmons in their healthcare division.
I am Alex Yiannopoulos. I joined the board with a background in food safety, currently working at Paoli Hospital for Aramark for Mainline Health, and very excited to, I think I just passed my 1-year mark, and very excited to finally have all 9 members.
Hi Seth, I'm Joan Capuzzi. I'm a veterinarian. I've been living in Radnor Township for 16 years, and this is I'm in my second term on the Board of Health. Nice to meet you.
And I'm David Simmons, and I am a retired diabetologist, and I'm halfway through my 2nd year as the chair. I've been on the board for 6 years, I think it is now, and in Radnor for 17 years. So welcome aboard, and maybe next month we'll actually have everybody here all at once, but it's been hard to do that. And thanks for joining, Seth. I want to make a minor change in the agenda and just move the COVID and flu update piece up. So although Delaware County does remain blue, Montgomery County is yellow. And I could, in 10 minutes, be in Montgomery County, and the virus probably doesn't care where the county line is. There has been a pretty significant change in the way we decide blue and yellow, in that we're not even looking at total cases or case positivity rates. because there are lots and lots and lots of cases out there, but we have no idea how many because many of them are being diagnosed with at-home kits and not reported, meaning that that virtually any ratio is of very little value because you can't get a ratio or a percentage without a denominator, and we don't have a denominator. That's the first thing. The second thing I would say is that although we are probably pretty far into the endemicization phase of this by the notion that we have very, very high case counts, but hospitalizations have only modestly ticked up, and fatalities, which you don't need a ratio, fatality is a pretty good count, they have not particularly ticked up. So clearly case morbidity and case fatality are significantly lower at this point, somewhere out there on the subvariants of Omicron. I would add that the previous coronaviruses that have endemicized themselves into the human species have not necessarily or almost not at all been associated with chronic lung disease, chronic heart disease, and fatality and long haul syndrome. So this is not just another cold quite yet. It may end up there. And although if I was anywhere between 15 and 55, I would probably consider my risk very, very low. I'm not. So my risk is not very, very low. And hence I've chosen to wear a mask today, which brings me to another comment on COVID, and that is there's a lot of kerfuffle about masks. A lot of it stemming from the fact that there are some costs to wearing masks for some populations, specifically school-age population, and for other mitigation, including remote learning, specifically school-age population. But a good fitting N95 mask provides a substantial amount of protection, both from me giving it to you and from you giving it to me. And I'm acting in a way that I think is demonstrating good principles of behavior. We're not completely out of this. And the last comment I have on COVID is if a war or an act of terrorism or some other major disruption had killed 1 million Americans over 2 years, we would really be grieving. If we had had disruption to our kids' education for 1.5 years, we would really be concerned over the future of those kids who had their education disrupted. If anything else were to have caused global supply chain disruptions and economic disruptions, we would be raising and recognizing. And I think the country is kind of done with this virus. Mitigation is done. But I don't think that we have really recognized the substance of the amazing disruption that we've lived through, the most astounding medical event that I've seen in my 50 years since I graduated medical school. And it's quite a remarkable thing. And until you really recognize it and come to grips with it, it will continue to filter through. And I think we're seeing a lot of that. So there's no action item off of that. But I think that people do need to be aware. We've been through a pretty amazing nearly 30 months, and we're not done digesting it and finishing up with it. And that's enough of my editorial comment. And anybody else who might want to comment, I'm happy to leave the floor. Any other comments? So, to old business. There is an addition to the old business that Bob asked me to bring up, and that is he is working diligently to bring the Colgate van, truck, whatever it is, for the oral health day for the community. And one of the decisions that he needs to work with the Colgate people to get this day is, do you want to do it during the week in the school parking lots, or do you want to do it on the weekend here at the Township building? He felt kind of coin toss, and I don't know that it will be our decision. I don't know what availability is, but I wonder if there's anybody who has any opinions on that.
Well, who can he coordinate it with? Because both places would be nice if he can get that coordinated.
I don't know that. I
He
don't know
can't, he
that-
only has one day?
I don't, yeah, I think it'll be a day.
And is this day in the next month?
That's the other
Yeah.
question. It does not appear to be, because I think we're coming
Because
up.
school's going to be done
Yeah,
shortly.
school's going to be done. My own opinion is I've seen a number of events take place, tree giveaways and all take place here, and it's a pretty good setup, and I think that although clearly the best bang for your buck is improving oral health in kids in terms of community health, but I think that a lot of parents might bring kids. It just feels to me like a weekend event here at the township might be, but again, Lisa, as you point out, weekends in the summer, there's a lot of people in this township who have the good fortune of not being around in the township on the weekends. So I don't know that I can give any direction.
I believe that if we want to impact the largest number of children and their parents, the best thing would be to do it during the school year in association with the school day. If we would like this to impact, beyond school children and the school children's parents, then I think it'd be better to do it here. So I think it's a matter of who our prime focus target is.
I think those are good comments. I think maybe we reflect that in the minutes, take that back to Bob, and since he's the oral health expert, let him work that out. But I also, that means unless we get it done before the end of this school year, which sounds progressively less likely, I think we're talking about in the fall and during the week at the schools, yes?
So would this be during the day, during the course of the school day, or after school? I mean, the thing is, most kids are going to be hopping on the bus and coming home. So, right, if it's something after school or outside of school hours, then it may be better to do something township-based out of school hours. If it's something during school hours, then obviously that would be great as well, but then you won't have the parents
Right.
present.
And the other issue with schools is it would be at one school.
Right.
And so if it were at one school during the week, you might lose the opportunity for the other folks. So I think the best thing to do is to maybe when, I believe Bob will be with us next month. If he's going to get it done before the end of this school year, then he's going to have to pull the trigger on a decision. And if he can't, then we can have this as a more robust discussion at our next meeting. People agree? Any other? Good. With that, I'm going to turn it over to old business and go to Maggie, if we may, and Maggie, we didn't let you introduce yourself to Dr. Rubin.
Welcome, Seth. Maggie Myers. I'm a retired neonatologist, practiced at the Children's Hospital Philadelphia for years and years and years. I'm now the Ward 2 Commissioner for Radnor Township and the liaison to the Board of Health. And I'm sorry I missed your interview process. I was at my son's 30th birthday in San Francisco, so there was no avoiding that. So new things from the Board of Commissioners that relate to this board. Everybody knows now that we did pass an ordinance on March 28th, which banned Kratom sales and distribution and Delta 8 THC sales and distribution within 1,000 feet of a playground, school, or daycare center, and banned sales to anyone under the age of 21. But that's a local ordinance. It is from the edge of a property line to the edge of a property line. So the one new thing on the horizon, as we advocated for and have now got a petition to send to the Secretary of Health of the state to encourage the state to actually rule on this. There is still in committee a bill by Congresswoman Pennycook and Jen O'Mara that would ban Kratom. There is, this petition can be signed in person on the behalf of Radnor Township and the Board of Commissioners, in person here during township hours at either the reception desk or up in the township manager's office. Peggy up there will have it, Peggy Hagan. Or it is on the website, and you can sign it electronically under the Forms Center. I found it pretty readily. And it just says online form petition to add Kratom and Delta-8 THC to the list of controlled substances in Pennsylvania. Ask for your name, your address, your email, and your cell phone.
I have a couple questions on that. What would so petition goes in, the state takes it up. What's the process, and what would enforcement look like at the state level for Kratom and Delta-8?
They would become a controlled substance like any other controlled substance that's, Category 1.
And are they necessarily linked? That is, say, they're very different compounds. With
They're very different compounds.
very different sets of issues.
Yes?
The bill that's going before the state links the two, or?
The bill that's going before the state, I believe is specifically Kratom related, Congresswoman Penny Cook's bill. I can check that for us. I think it's specific to Kratom. But I have it right here. Yes, the Kratom Consumer Protection Act is what it's called. We were advocating for both because of mostly the sort of lack of any kind of quality control in production or assay of content, or standardization of content, labeling, packaging, all of that. So our thought from the township point of view, we're just advocating for this to the state.
So I couldn't agree more. Kratom is a problem because it falls into a black hole, and since it is clearly a strong psychoactive compound, the absence of any regulation of dosage, any regulation of manufacturing, any surveillance of manufacturing, makes it a pretty substantially more problematic issue with no guidance from the federal government and significant experience suggesting that without any knowledge of rates, there are issues that arise, and just having it wide open like that leaves a bit of a hole. The Delta-8 is a little different from my point of view. In a state that has legalized medical marijuana, Delta-8 is pretty much designer marijuana. You have the issues of non-regulation of production and content still.
And the production itself is full of terribly toxic compounds.
Right.
It's actually super ultra concentrated from hemp.
Yeah, so what I would think from a...
So it's a cannabis product, but
right,
not a marijuana
Yeah,
product.
I would want to, for consistency in regulation, I would think that what I would support would be putting Delta-8 into the state marijuana regulation, take it out of the cannabis, out of the farm product, hemp category, and put it into the THC/marijuana and regulate it in that way, since there's already a competent authority which has an obligation for providing regulation and enforcing regulation. It seems to me that would make more sense than kind of putting it in the black box hole that Kratom falls in. But that's just one man's opinion. But in terms of discussions with our lawmakers, that would be what would make sense to me.
Mm-hmm. Well, this is a plea to the Secretary of Health, so it's just really,
Right.
I don't like to say token, but it's our feeling that both substances are bad, as they are right now. Maybe with some regulation, you could, pull Delta-8 THC into a different category.
All right, so and on the specific store on Lancaster Avenue, my understanding was that if you calculated from the center of the building to the center of the building, it was more than 1,000 feet away. But if you count from edge of property to edge of property, it is less than 1,000 feet away.
That's correct.
And therefore, with the new ordinance passed by the township, they will not be permitted to operate a Kratom CDP, Kratom THC store there. Is that correct?
That would be correct. They haven't gotten over their building permits and certificate of occupancy hurdles yet to have to face that. They have filed a lawsuit that nobody has actually seen yet, but
Right.
John may have seen it in the last week. As of the Board of Commissioners meeting a week ago, he hadn't.
So they're still in the limbo of not having adequately provided documentation that they can run any business at all with their permits.
Right, and they opened without filing any permits.
Is there any cost for them to bear for having opened without filing any permits? in
Not
terms of
per se.
Nothing?
Nothing on the books, other than I think you get extra scrutiny over the permits that you do file.
I think they've had a lot of scrutiny.
Yeah, I think they have too. They do have a 10-year lease.
Yikes.
Yikes. And is that petition for anybody in the community to sign online?
That's for anybody that lives in Radnor Township.
Thank you.
Maggie, the quantitative amount, 1,000 feet, I'm wondering how that number of feet was arrived at, if it's based on any research, and to me, it seems kind of insignificant in the bigger picture of it being a nucleus of influence if it exists in our township versus, 1,000 feet, 1,001 feet.
It came
whatever.
out of the
But
state
how-
medical marijuana law.
Okay, so.
I mean, it was sort of, that was mirrored off of that.
Got it, thanks.
In other words, designed to avoid singling out, but rather to align with a regulation around other businesses where the regulation of that business is in the community's interest.
That's exactly right.
Maggie, do we know where the state came up with 1,000 feet?
No,
I mean, I'm
I don't,
wondering,
I
it's so
don't.
arbitrary.
We as a greater collective might, but I don't know where they came up with that.
If Radnor Township is going to follow that 1,000-foot rule, shouldn't we know that there's evidence that if it's 1,010 feet away, it will not be of harm or influence to these school kids or other people in the community?
It would be nice, but I don't know that we have the resources or ability to determine that, and I don't know where the state, if they had any data that they used. I mean, it seems like you just at some point have to draw a line, but I don't know where they came up with that.
Okay. My opinion is that we as a township do have to look at that and think about that maybe above and beyond the state's recommendation, because we can go above and beyond in terms of our restrictions and what we want in the township.
You mean we could make it 500 feet if you, is that what you're saying? We could make it even
I'm
more?
not saying be more lenient.
Ah,
I'm
okay.
saying quite the opposite.
Yeah. Well, we did it intentionally to align with the state so that it seemed as if everyone was on the same page. But again, I can't say where the state got that number. Yeah, I can't really say anything more about it.
I'm wondering if maybe the state came up with that number from, years ago as far as a drug-free zone around, it might be related to a legal aspect, because I think if you were selling drugs within a certain distance from a school, you would have higher penalties. So maybe it was a piggyback off of that law.
I believe that that's correct.
I bet that's
And I also believe that you could look really hard and long for data, but you won't find data. I don't think it's data-driven. I think it's a practicality. That is to say, exclusion zone that doesn't necessarily, it's not a fence, it doesn't protect, but it does kind of ring fence places that you don't necessarily want that kind of business. And remember, these are compounds that are available online, so it's not that we are doing anything that makes it impossible to access these compounds, but rather it sets a different tone for the conduct of commercial operations in Radnor Township.
Right, it is sales, not use of
Right.
the product.
Right.
So,
Right, exactly. And Joan, a couple of items on all business that we haven't completely closed up
Yes.
yet, the health ordinances and the road safety.
Okay, so the animal control ordinance, Animal Control Officer Bill Gallagher and Lieutenant Pinto are working on that together, and they went through and did further, went through and did some further edits from the version that I supplied to them. And then it is now with the police chief, and then from there, he's in the process of trying to get it in front of the township manager. From there, it goes to the Board of Commissioners, and it is indeed planned to go in front of the Board of Commissioners in June. That's the plan.
Are they meeting before us or after us in June? Because I think we need to get you a cake for when that finally comes into play. Okay. And the road safety?
Road safety, I have a message into Sergeant Mark Stanson, who is going to be handling any signage issues. So still haven't moved on that. Hopefully, I'll have more information in June, at the June meeting.
Great. I think that is an issue that road rage, aggressive driving, automobile accidents, and animal mortality on the highways is not just in Radnor Township. I think post-pandemic that has all been crazy all over the place.
It has been. It certainly has.
Thanks for those updates.
Sure.
So from that, we go to new business. I'd like to turn back to Maggie. Is there anything else that you would like to bring to us from the Board of Commissioners that we should or need to be aware of that you'd like to bring up for the meeting here?
Well, we've done all kinds of exciting things, but none of them are really relevant to the Board of Health. We have just passed a bond for stormwater drainage, the will acquisition, and that in a way you could stretch to health, which has been long in the works and much wanted and finally passed at the last meeting. I do have a question, though. I got the report, as I'm sure everyone did, of the rabid raccoon that was found, and I just wondered if there was any follow-up to that. I don't know any. I should have bugged somebody about it.
Perhaps I should be aware of this. I don't know. I don't know about this rabid raccoon, but
yeah, you should. We should get you on whoever. Like I just got it on the township. I get the township emails. You go on the website and sign up for regular warnings that tell you when somebody's car has been stolen and when their house is burglarized, and then up came a rabid raccoon.
Can you just update the group? How was it identified? Was there any contact between the raccoon and people, or was it just a sick raccoon?
I don't know.
Okay.
So I saw the report. It was identified because it was a daytime sighting of an active raccoon. There were no reports of any bites or contact, and there was nothing in the report about anybody having to go to the ER or requiring rabies vaccine.
Okay.
So did that go to the Delaware County Board of Health?
I would think so.
It did go?
I would think so.
I would think so.
Yes,
That's
yes.
usually what would happen when Radnor, they would go to the Radnor, our committee here, and now it's at Delaware County. They should be handling all animal issues.
Right.
I should note, and this is a good time to mention this, that yes, while daytime sightings of raccoons can be in the general category of less typical behaviors, raccoons and foxes can also be seen healthy during the day, early morning or evening, and they can still be healthy. It doesn't necessarily mean that they're rabid, especially now when when they've recently had had offspring, had litters, they do need to increase their food consumption. So you will see foxes during the day, early morning, early evening while it's still light out. I have foxes come through my yard, this same one every day around 5:30. So I think some people get very nervous about it. Yes, it can also be a sign of abnormal behavior in one that is rabid, but all within the context of good observation of whether it's also seems unhealthy. And rather than just jumping to that conclusion, I think people do get very nervous about that. Sometimes they can be rabid, but usually not.
Yeah, that's a great point, Joan. I have a spot in my woodland that I put out scraps for the fox. We actually have a path in the grass we call the fox trot, because the fox is constantly, and this time of year, it actually has stopped. For the last month, there were regular daytime sightings of the fox. But that raises to me, there's an awful lot of fear of foxes out there, and the risk of the fox population to the human population is almost non-existent except for the occasional rabid fox, right? I mean,
the risk is really low. The foxes are very timid. They're very afraid of people. They're afraid of dogs, and there has been mass hysteria about the foxes this year. I've seen online just in next door neighbors, and I've seen some people mention that they make great pets, and that the cubs are so cute. So I do worry a lot when you get people online sharing ideas. I think in many cases it's not a good thing.
when well fed, they're beautiful, beautiful creatures.
They're
a delight to have in
beautiful.
our environment, and I would like people not to be trying to do them in. They're not coyotes, and there was a time when it was said that rabies was endemic in the raccoon, fox, and bat populations. Does that remain true?
I guess I don't know how they're defining endemic. What I always explain to people is that any mammal, including a mouse, can carry rabies. Any mammal. So, from that standpoint, yes. The top animals that Pennsylvania sees rabies in pretty much trade places between foxes, raccoons, and groundhogs. So I would say they're the top three. Opossums as well. I think bats have always been around 4 or 5, one of the lesser, but perhaps maybe one of the greater. I don't know. There aren't as many bats that are going to get turned in to get tested as there are, a fox that's limping around or something like that. Those rabid bats that die, for the most part, probably go unnoticed because they're small and they're not as much in human populations.
I used to see a lot of bats flying around, and there's that fungal disease that has kind of decimated the bat population. Do you know anything about?
Yes.
Has the population
White
stabilized?
nose. I think, well, they're immunocompromised because I think one of the main reasons is they're not getting access to the food they need, where everyone is spraying and killing their food sources. So there aren't as many fruit bats. I know when I was a kid, and I lived in Marion, which does not have as many trees. It's a little more built up. And I'll tell you, we had bats just swarming over our house all the time. And I even out here where we have so much more woods and natural waterways, there are fewer bats, and I think it's because of all the mosquito spraying. And I think we really need to think about all the destruction that we're doing to the environment and the ecosystem. I think it's a good sign that it seems like there have been more foxes this year. I'm seeing more, and I'm hearing more about it online. So that's a positive thing, and I think it's a sign of a healthy ecosystem. I know a lot of people are putting out rat poison, and I know just from being a vet, we're always having animals that consume it, and I wish people would stop using it. But, you know, that kills a lot of the white-footed mouse population, which are one of the main food sources for foxes. However, the foxes are out there, so that's good. They must be getting something.
It's almost exactly a year ago, I found a dead great horned owl in my yard, and it was, Officer Gallagher actually took care of it, and it was clearly, it had bled to death. It had blood, and it had bled to death because it ate a mouse that had been poisoned with rat poison.
That's a tragedy.
Maggie, so the bottom line answer to your question is that it's a county issue, not a township issue, but was Officer Gallagher going to come and address us when we finally get the ordinance thing done?
I believe he is. He was not able to be here
Right.
tonight because he's out of town, but.
And maybe we can talk about more issues than just the animal ordinances when he comes to join us.
Yeah, and I'll follow up with him about that.
Excellent, great, thanks. And because, I can't believe I'm blocking on her name, my benign name. Because Jenny is unable to attend today, we'll defer update from the school district to our next meeting. And we've finished the COVID and flu update, so that brings us to the highlight of our May meeting, our student update.
All right, so the students are actually putting together a presentation for next month's meeting with kind of a summary of their findings, getting things together right now. They've pretty much gathered the information, just kind of putting it together into a presentation.
Okay, so no need for a specific update now?
No, I don't think so. It'll be good for next month.
Wonderful. And that brings us to public participation.
Sarah Pilling, 29 Garrett Avenue, Rosemont, and I've lived here as of 2 weeks ago, 40 years, which I can't believe. I'm coming to you once again. I've got on my climate change hat of heat and senior citizens. I spoke of it before, and then David spoke of it again. And summer is coming. And I request, beg, implore you to come up with some sort of an idea to present to the Board of Commissioners. And there's a meeting next Monday, and then they only have one meeting in June, so we're talking soon, to come up with some sort of an idea of cooling for seniors. I know that more than seniors are affected by heat. It's little kids and seniors, but there are many seniors on fixed income, myself included, and it's getting harder and harder and harder to make it on what we have. And people either don't have air conditioning, can't afford the air conditioning if they have it, or many people are afraid to have a window open at night. Yes, even in Radnor Township. So we have about 8% of the population are seniors. And another category is the poverty rate in Radnor Township is 6.8%. Now, pre-COVID, when this happened before, Bob Sinkowski jumped to, and they opened this building, and they talked to the senior center, and they talked to the library, and I don't know where the money came from, but the police were given a number of box fans, and they know where the seniors live, and they were given box fans to get them through it. This last summer, in July, we had 21 days where it was 90 degrees or higher, with a dew point of 69%, which is just about oppressive. I'm enough of a geek that I keep track of the temperatures in the summer. I live in a house with very little air conditioning. The house is too old, it wasn't built right. But there were nights when at 11:30 at night it would still be 85 degrees, which means your body can't recover. So I think if this township is committed to health and welfare, that something about heat has to be done. We have no idea what this summer's temperature is going to be. Look at what we've been through this spring. It's either been too cold or too hot or too wet or too dry. We were to have tornadoes today. When I came in, the sun was shining. The schools got out early. A meeting I'm supposed to go to later was switched to Zoom because we'd be in the middle of tornadoes. It is totally unpredictable. But if some preparations aren't made, then when the moment of truth comes, everybody shrugs their shoulders and says, well, what are we supposed to do? So I'm urging you to think about this hard. I try not to panic, and I'm pretty discouraged. But if you listen to the IPC report, CC reports, and the subcommittee, they're saying the next 5 years, it's going to be a disaster. And what's going to happen in the East is it's going to be heat and storms. So I really think we need to do something. I know too many people, we have pockets of neighborhoods, Garrett Hill is one of them, older houses that were not built for air conditioning, and other areas in the township. There are people who are going to die because of the heat. And I'd like to see Radnor use some initiative and come up with some ideas. Now, Robin Mann is with me on this climate change bit, and we were talking today, and she had a suggestion that to look at the various areas and to pick in each geographic area a church or a school or a business or something where the township could arrange for it to be open long hours with cooler for people. And I think she has a good idea rather than everybody just having come to the township. And last summer, it couldn't happen because the township had rented this room to a group, I was told, outside the township. So people from the township couldn't have even come here. I think it's a serious issue. And I know what it's like to live through heat. As an older person, I will be 85 years old in 3 weeks. And it's getting harder and harder and harder. Fortunately, I have enough that I play games. I don't turn my air conditioning on until 11 o'clock at night, just long enough to cool it down. The rest of the time, take a nap, take a shower, get in the shower, get wet, go sit out on the porch. There are ways to do it, but I don't think there are people who think of things creatively like that. So I would urge the Board of Health to really take a look at this, not next August, but to begin to put something together to encourage the township to do something before they sort of adjourn for the summer. Thank you.
Thank you. I do want to just recapitulate that Sarah had spoken before. There were 2 programs before pandemic that are referred to. One was distribution of fans, and that was not a township, and I'm just reiterating what the facts were. That was not a township program. I spoke to Bill White about it. The township was a pass-through for that, and as a consequence, the fan program is not likely to come back. The other program was to provide cool shelters during the worst of the heat waves, and as you pointed out, that was suspended for pandemic reasons. I don't know whether it's 1 or 2 summers now, 2 summers, but I think that laying out the facts, more people die of heat-related climate issues than die of cold-related climate issues. There's absolutely no doubt that extremes of weather, whether it's extremes of heat or extreme storms, are getting worse. And it will be a problem. I don't know that we, as the Township Board of Health, have much to offer, but I agree with you that this is an issue, and it will become progressively a cause of concern, and it actually is one of the things that I was thinking about when Maggie talked about stormwater, and when we were talking about issues that are health-related issues. I wonder what happened to, what was it called, the Radnor 100 project? And where are we on going from gas-burning vehicles in the township to renewable energy source vehicles in the township? Where are we as a township in terms of demonstrating? We're not going to fix, the Radnor Township Board of Health is not going to fix the climate change issue, but we certainly can demonstrate leadership in the community and in the region and further in terms of what we do in this township to mitigate those issues. And I would point out from a Board of Health issue, 100 years ago, there would be nothing that would be more important to the public health than the management of water. And we've kind of taken for granted that clean water coming out of the tap is a human right. And I'll tell you that the way I read things, we're more likely to run into water shortages than true energy shortages in the coming 10 years. So these are all related. Sarah, I appreciate you coming. I think that this may be a little bigger than the volunteer, no budget Radnor Township Board of Health, but I think we will absolutely take what you have to say to heart and use our influence. And I'm happy to turn the mic over to anybody else who wants to make a comment.
Does anyone know, like, who determines when that emergency preparation system is put into effect as far as heat? Or I know they've done it for hurricanes. I recall in the past of having the areas open. What's like the regulation regarding? I mean, people may not know.
There's state emergency management, and since we have not previously had a county level Department of Health, I do not know. I think it's a good question, and probably we ought to bring county back in and do an update on what the county is doing and is not doing, and what are the things that we should count on them for, and what are the things that we need to look elsewhere for. So I think it's a good question.
I mean, that was my ask. Is the Delaware County Health Department going to handle heat-related cooling centers throughout the county? And it's end of May, so. So what's the action item, David?
Any suggestions on that? I think that we could ask Maggie to bring this up to the Board of Commissioners. I think that we think unanimously could endorse that we ask the Board of Commissioners to consider what role the township can play and will play. And I'll get back to Bill White again and see from a township management point of view what can be done specifically with regard to the coming summer weather. So I guess those are the two action items. Now they seem somewhat inadequate, but I think that's what we have to offer.
Well, I can certainly bring it up as new business at Monday's Board of Commission meeting, because I think by June we're going to probably see one of these, if not more than one of these 90-degree days. And I think it's always better to be ready, you know, to have a plan. Even if the county has a plan, we should be able to at least be able to tell people what the plan is.
And that's my request, is to have a plan, not get into the middle of a heat wave and go, oh, well, what could we do? It just
And I
doesn't
do,
make
I'm
sense.
sorry, Sarah, you had mentioned about this room last year or whenever, but I know that they're redoing all the AV equipment in this room this summer. So I think it's targeted for August mostly, but there'll be some restrictions there too.
And we don't know what the summer's going to be like. I mean, it's been hotter every summer since 2010, and I can tell you the gardening thing is just up for grabs because the plants just don't know how to behave. And if that doesn't say something to me, I don't know what does.
I couldn't agree with you more. I'm growing things that used to grow only in Georgia and Carolina, and now they're totally tolerant, and you can't grow delphinium or lupin in this part of the world anymore. 20 years ago, I could.
So just to summarize, Mag, you're going to bring it up at the next, as a new business. David, you're going to get in contact with Bill White. And then what about the county level?
I think the only action there is to talk to the county folks. We're due for an update from the county.
Okay, so update from the county, I'll put on, okay.
And I don't know when we can arrange that. I don't know whether we can get that done by June or whether that's going to wait, but that's along the list of items for aligning with the, it was sunny and delightful when we started this meeting.
I saw those black clouds on the horizon. So who's going to contact the county?
So I don't think it's a reasonable timeline to expect the county to jump to, and I'll reach out to county and ask for an update, and I don't know whether it will be June or September, but I think that we need to hear from county and talk to, I think we need to be aligned with County Board of Health anyway. So as one
Right.
of the alignments with the County Board of Health, a discussion of the impact of climate change on responsibilities and programs at the Board of Health level is a very reasonable thing to include, yeah?
Yeah, and I think that they probably have developed, I don't know if they've actually had time to develop, but should develop a heat plan that we could at least get their plan on paper. I mean, we may not have a physical person here to explain it for us, but it would be helpful to have it on paper, if they have one.
And if they don't, we should ask them if there are any plans and what the relationship is to the state, because emergency management is predominantly a state, but there are volunteer organizations at the county level, the DCCC and organizations like that. But emergency management is basically a state function. Any other comments? Is there any other new business that needs to be brought up?
Very quickly, I know because Kiki's not here, but I know she wanted to do an announcement about this past Tuesday, the 10th, was, I want to make sure I got the name exact. It's was National Fentanyl Awareness Day.
National what?
Fentanyl.
Fentanyl.
National Fentanyl Awareness Day. It's over half of all fatal drug overdoses in the U.S. at this point. So it's, as we look to the different kind of components of what makes up the opioid crisis, that is, as I just said, it's the majority of all drug fatalities in the U.S. right now. So it's definitely, it is something that is serious. It is something that is in all communities, and it's something to keep an eye on as we as a board continue with some of the efforts that Julie's gotten started with resource lists. That is definitely something that I'm sure Kiki is going to want to expand on in terms of what resources are available. The other thing I had, just very briefly, since I was going to go with health officers report, forgetting that now that we have the county, health officers reports are not going to be necessarily part of our regular business anymore, but that I know that there's been some community concern about the health inspections and the restaurant inspections specifically going from Township inspections to then to the third party privately done inspection, well, not privately done, but the third party inspectors, to now the county is doing it. And I know there's been some concerns about, well, it's a new board and it's a new thing, and are they going to have the same standards that Radnor had when we were doing it in-house? So we are lucky enough that we had our in-house Radnor health officer is now the one running the show at county, and based on the reports that I've been looking at. I haven't done a ride-along like I did with Marie when she was here, and then did again with the third-party inspectors, but just going off of reading the reports that the county inspectors have been submitting, you can just see from when it went to, from Marie to the third party to back to Marie, that the quality is kind of right back to where it had been. And I'm saying that as a positive thing with, Marie has clearly taken the standards that she was using here, and they're being used at the county level. The documentation in terms of both the number and the sort of the different types of violations, it's just clear from the documentation that that has greatly improved since the county has taken over. And most importantly, that on-site corrections are back up, which is a very important tool because that is how people are kept safe immediately. It's, follow-up visits are great in terms of enforcement, but in terms of kind of keeping people safe right in the moment, and also just educating the businesses on what they need to do. That is very important, and that is something that had kind of not been happening as much while Marie was not here, but now that the county has taken over, they are back up. So at least from what I've been seeing of the reports that have been submitted so far, the county is really doing an excellent job on these inspections. So I just wanted to provide that update because I knew that there was some concern about that in the community.
Thanks, Alex. I actually have a couple questions for you on that.
Sure.
So we did not put a health officer's report in. Are there other components of the health officer's report that remain with the township other than the inspections? And should we be asking Kevin to do a health officer's report?
Really the two components had been the restaurant inspections and the animal-related issues. At this point, the county has taken on both of those.
And are you-
We still have Maggie providing us updates on, if there are board issues that relate to what we're doing here. But, at this point, we don't have a health officer in Radnor. So, Kevin was kind of filling in as the health officer overseeing the, the third-party inspectors that we had, but.
Are you continuing to review the inspection reports?
Yes, I am.
Would you like to have an agenda item just to give us a quick update on inspections as they reflect on health in the township?
We can. I think, the most, I would say kind of the most important thing is, well, if any restaurant actually is in such serious violation that it gets closed down, that will, show up in the local media. The reports are online where everyone can go on. It's pafoodsafety.pa.gov. You can just search the name of the restaurant. If it's a restaurant that has, a common name, there's even just within Delaware County, there's more than one Fellini's Cafe, for example. You can also search by street number and name or by city. Here in Radnor, we have Wayne, St. David's, Radnor, Villanova, Bryn Mawr. We also have Newtown Square, but there aren't any restaurants in that part of the township in terms of mailing addresses. So you can also just search by city and see kind of all of the inspections that have been done. I'm happy to provide if there's any kind of, big announcements. I will say, day to day, it's not uncommon for a restaurant to have, a couple of violations here or there. What they're really looking for in terms of when they're, shutting a place down is, the seriousness of the individual violations. They do also, there's, in and out of compliance on each of the different components on the report. There's also, at the end, they get kind of a final grade, kind of similar to when you're in school. You get, your individual grades on your quizzes and tests and homeworks. And then at the end of the semester, the teacher gives you a final grade. And at the end of the report, they will do a final grade that's either in compliance or out of compliance.
If you have anything in your surveillance that you feel ought to come up to the board, please, I know you will, but bring it up to the board. I did have another question on the fentanyl comment, and that is, my understanding is that there is a large settlement between the one pharmaceutical company and a coalition of states. Does anybody know, was Pennsylvania part of that settlement? Are there funds coming to the state of Pennsylvania, and will they filter down to anything that happens at the county or township level for us? Anybody know?
There were, Pennsylvania was involved, and it filters through the county.
Another item for our update from the county. Because when we did discuss the Kratom store business, and one of the things that was absolutely clear to me is that there was a lot of kerfuffle over Kratom and Delta, and we had an action, but lurking in the background is an addiction problem that's there, and it isn't going away, and we're not immune here in Radnor Township. Okay, any other new business?
So I have Alex down as just updating the board if there's anything glaring on the reports coming from the restaurants, from the inspectors
county.
of Delaware County.
Yeah.
Got it, okay.
All right. With that, do we have a motion to adjourn?
Just let you know, June 20th is the next meeting at 5:30.
Thank you. Is there a motion to adjourn?
Is it June 20th or June 21st? Because I think it's listed on the,
It's listed as a
Agenda.
Tuesday, yeah.
I think it's listed on the agenda as a,
So I don't know the answer to
It's,
that.
Monday is the 20th.
Right.
Yeah.
It's
but
listed as
sometimes we can't
Tuesday,
get
the
room
21st.
on Monday because the
Oh.
Board of Commissioners, and it is on.
Anybody know?
No, but we'll clear that up.
Usually we go before the Board of Commissioners, we just have to get out of here in time.
Yeah, but it is listed for 21st here. We'll have to clear that up.
Okay.
So it's either that Monday or Tuesday.
I have the Board of Commissioners as June 13th,
Okay, so it's not that, so.
but that doesn't mean it's not something else.
Doesn't
Or
mean
that
it's
I'm
not
wrong.
something else. Exactly. I'll get in touch with Kevin and find out what the story is. I think I had put it in as the 20th when I sent over the draft for the agenda, and it comes out on the 21st, so I'm guessing that there is an issue, and that we may have the 21st and not the 20th. TBD.
Sorry, David, I just thought of one other, that I think we should also say yourself and myself and Kiki also attended the training for township boards. And I think we should bring up one thing that I think it was new information for both of us, and we should probably share with the board that in terms of group emails, because that was something that was covered during the training that was news to me, that we're allowed to send emails to the whole board for informational purposes, and we can have group discussions about, scheduling and kind of substantive issues in terms of anything that wouldn't be put to a vote of the board, but that we're not, unless my understanding of it was that we're not supposed to send an email out as a group and ask for everybody to reply to that individual email, which I think it just is something we should all be aware of, because it wasn't something I was aware of.
Yeah, that's a really good point, so if I may expand on that. If you reply to all on emails on topics of discussion of the board, it essentially becomes a board meeting and is disclosable. And to me, it's critically important. Most of what we do is provide technical advice to the Board of Commissioners. And to do that, sometimes we have to bat things around. And Alex and I have had some hammer and tongs discussions on a couple of issues in the past, and we've always managed to get to a place where there's some kind of consensus or agreement, but it takes some back and forth. So that to protect yourself from being accused of violating Sunshine Act or Freedom of Information Act, we just should avoid reply to all You can have discussions, you can have one-off discussions because they do not carry the weight of the
And even
board.
subset discussions, as long as it's not a
Subset
majority of the board.
Right, exactly. So as long as you do not form a quorum of the board, you're not violating Sunshine Act or Disclosure Act. That's a very good point. Thank you, Alex. And with that, we outlasted the storm.
I was hoping that would happen.
That's why I added that.
Thank you. May I have a motion to adjourn now?
A motion to adjourn.
Second?
I'll second.
Any objections? If not, meeting is adjourned.